Good day. I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health in Atlanta, Georgia. I'm joined today by my co-author, Dr. George Lau. George will introduce himself and outline why we brought together this article for this issue of Clinical Liver Disease.
Hello, everybody. This is George Lau. I'm the chairman of the Humanity and Health Medical Group and also director of the Humanity and Health Clinical Trial Center in Hong Kong. Concurrently, I'm also the chair professor and director of liver transplant and advanced liver disease in the 5th Medical Hospital in Beijing. It's my pleasure to work with Dr. John Wood on this article relating to the guidelines published by the Free Regional Liver Society. That is APASO, ASLD, and EASL. The reasons of getting these guidance published is to help our colleagues as practicing hepatologists taking care of patients either in elective circumstances or emergency circumstances of how to handle these patients under the COVID-19 environment to enhance the safety on the one hand, and also to ensure the quality service uninterrupted as much as possible to our patients.
Thank you, George. I'll now go over some of the high points of the recommendations of these three associations. First, in regard to healthcare worker and patient safety, the associations were in strong agreement that healthcare workers should have access to the recommended personal protective equipment to help them be safe while providing care during the COVID-19 pandemic. Secondly, the three associations were also in strong agreement that measures in social distancing should be put in place to reduce contact between healthcare workers and patients. For example, routine care can be delivered through telehealth channels. Liver biopsies and endoscopies should be prioritized for persons with the greatest need. For patients needing urgent care and seen in the clinic and in the hospital, those patients should be screened for possible contact with others who have COVID-19, screened for COVID-19 symptoms, and tested for SARS-CoV-2 infection. Regarding treatment of hepatitis B and hepatitis C, an essential intervention for hepatitis elimination, the associations agreed that hepatitis B and hepatitis C testing and treatment should continue, that if patients develop COVID-19 while on therapy, those therapies should continue. The associations also agreed if patients have COVID-19, there's not a reason to start hepatitis B and hepatitis C treatment, except in the situation of a hepatitis B flare. APOSL went into some detail about the management of hepatitis B for patients with COVID-19. George will outline some of those considerations now.
And in our guidelines from APASO, so we also mentioned about the importance of identifications of chronic hepatitis B carriers, that is surface antigen positive patients, and to have preemptive therapy nukes for those who received immunosuppressive therapies such as IL-6 antibodies and other immunosuppressive therapies which are prescribed in certain parts of the world to treat severe COVID-19.
Turning now to some of the other recommendations for patients with chronic liver disease. Testing is recommended for chronic liver disease patients, particularly when they develop symptoms and signs of a worsening of their liver disease, such as hepatic encephalopathy or acute on chronic hepatitis. It's recognized that hepatitis can increase in severity as COVID-19 disease increases in severity. The cause of liver disease in patients with COVID-19 can be multifactorial. Turning now to some of the other recommendations of the association regarding liver cancer, surveillance for liver cancer should continue, recognizing that the interval for those surveillance visits might need to be prolonged. The associations varied in their recommendations for therapy for liver cancer, and I urge you to go and explore those in more detail as they relate to your clinical practice. Regarding liver transplants, the associations recommend testing of donors and recipients, and persons with COVID-19 should not receive a liver transplant. For patients who have received a liver transplant, immunosuppressive therapy should be preserved as much as possible, including patients who have mild COVID-19 disease. Considerations might be necessary for a change in immunosuppressive therapy for persons with moderate or severe COVID-19 disease. In summary, the three associations are in strong agreement that there needs to be changes in patient workflow and changes in liver procedures to reduce the risk of transmission of SARS-CoV-2 in the healthcare setting. The associations are also in general agreement about their approaches to the evaluation of liver cancer for patients with COVID-19 and the management of patients with liver cancer and in the post-transplant setting. Also, I would like to emphasize that the associations are also in strong agreement that treatment of hepatitis B and hepatitis C should continue for patients that have not yet developed COVID-19 or that do so after hepatitis B and hepatitis C treatment has been prescribed. George also has some parting words, and I'll now turn it over to George. Thank you for reading our article and for reviewing this video. I'm Dr. John Ward. Thank you.
And I hope that we will all be able to keep safe and to serve our patients with liver diseases with these informations. Thank you.